Welcome to Verified RX, your prescription for success. Brought to you by the Vizient Center for Pharmacy Practice Excellence.
Historically, Vizient published the Pharmacy Market Outlook twice a year. This year, we're launching the Spend Management Outlook, combining the power of the Pharmacy Market Outlook with the Vizient Budget Impact Report. For strategic planning, this better aligns pricing projections across the healthcare supply chain and key market insights. My Vizient colleagues, Dr. Carina Dolan, Associate Vice President, Clinical Oncology, Pharmacoeconomics, and Market Insights, and Jeff King, Research and Intelligence Director, join us today to give us an inside look at the inaugural Spend Management Outlook. I'm Carolyn Liptak, Pharmacy Executive Director in the Vizient Center for Pharmacy Practice Excellence, and your program host. Carina, it's great to have you back. Jeff, welcome to our podcast. Since you're new to our audience, can you tell us a little bit about your role as a Research and Intelligence Director?
I've been on this team for a little over 20 years now. I have three primary functions that I work on. I provide research and intelligence to our category managers, which involves things like market size, market share, what new products have hit the market, how the market's changing, and different dynamics. I also look at what could be causing inflation pressures, the different types of raw materials that products are made from, freight, cost of service labor, and energy cost as well. When a supplier comes to us for a price increase, I provide our category managers with information on how to combat those price increase requests and to request price decreases also at times. The third thing I worked on is the Budget Impact Projections Report, which is basically the device, capital, and services side of the Pharmacy Market Outlook, except we're looking at the other side. And we've been doing that report for over 20 years now.
So the Pharmacy Market Outlook and Budget Impact Report have now been merged into one document. Carina, why the transition from two different reports?
Now, more than ever, Carolyn, healthcare providers are being tasked with making the most judicious decisions and determining how they will apply their spending power for critical products and technologies across the entire supply chain in order to preserve quality care access to patient populations that they serve, while also ensuring financial sustainability. Providing this aligned perspective on the trends, on the market factors, on the data insights, and on future expenses or projections across these dimensions of spend management, they'll provide a more seamless approach for our provider customers. We also call them our members, and they'll be able to view these aspects in both a targeted way as well as an aggregated fashion in order to assist in their budgeting needs.
So Carina, you mentioned spend management. Jeff, can you further define the term spend management?
Vizient aligns prominent areas of spend under one expanded category that encompasses total expense management for hospitals and health systems that we call spend management. We basically have it divided into 6 primary categories. First one is the medical and surgical products, laboratory. Third is indirect spend and purchase services, then capital and imaging equipment solutions, and finally pharmacy and physician and preference items, which includes orthopedics, cardiology, and surgical services.
That's interesting. Carina, what were some of the key insights highlighted in this edition?
First, I want to mention previously for the categories of med-surg, laboratory, indirect spend and purchase services, capital equipment, as well as physician preference items, insights into these categories had not been provided. We're very excited to offer this as an enhancement to our members. For med-surg, the greatest spend for members was for IV pumps, tubing, and solutions. This section also includes additional content on the IV solution shortage that happened at the end of last year and is still ongoing, tariffs that are currently in place on products manufactured in China, and cellular and acellular matrix-like products. These are also known as CAMP. For the category of laboratory, their highest spend was around molecular technology and addresses new FDA regulations on lab-developed tests, as well as avenues to help lower laboratory costs. Indirect spend and purchase services category, their greatest spend was in facilities management, followed closely by IT expenses. And this section dives into trends around the decrease in human resources expenses due to the decrease in temporary staffing, as well as the continued trend in increased wages for service workers.
Thanks, Carina. Jeff mentioned earlier that the SMO also includes capital equipment and physician preference. What did you find interesting in these sections?
The highest spend noted for capital equipment solutions was endoscopy equipment. And this is a great section that provides the anticipated increase in outpatient imaging services that we're likely to see continue to drive the spend for this category and the complicated reimbursement landscape that we see for capital equipment as well. And for the physician preference items category, this section is broken out into cardiology, orthopedics, and surgical services. Cardiology has the potential to be driven by an increased use of CABG procedures. This stands for coronary artery bypass grafts, as well as electrophysiology pulsed field ablation procedures. Their highest spend was in peripheral vascular products. For orthopedics, their highest spend was in hip and knee implants, followed closely by spinal implants. These procedures are experiencing some movement in the ambulatory surgical centers, and this section is a great source for more information on that movement. And last but not least, surgical services, their highest spend was for GI lab accessories, and this service line is likely to be impacted in a big way by AI as well as surgical smoke evacuation systems.
What new enhancements or insights are included in the pharmacy portion of this edition?
For those who've been following at home for a while with our previous Pharmacy Market Outlook podcast, the pharmacy portion includes a view of drug spend with the overall projection, a specialty projection, pediatrics projections, as well as key therapeutic categories. And for this edition, we're really excited to launch another enhancement. This enhancement includes projections by segment of the market for pharmacy. We have forecasted a projection for the acute care market as well as for the ambulatory market. And within the ambulatory market, we've provided projections based on provider administered drugs, so medications that would be infused within an ambulatory infusion center, as well as medications that are self-administered, as well as medications that fall within specialty distribution channels.
What prompted you to include projections by segment?
This is something that we have been wanting to do for many years. At the end of last year, we were able to meet with some members who provided some pivotal feedback to us, explaining how their budgets are viewed and how looking at the projections in this manner would help them budget. Based off of their feedback and working with our amazing analytics team, we were able to bring these projections to light.
We all look forward to reading all of the great insights you and your team were able to uncover. In the past, you've reviewed the methodology for the pharmacy portion, the analysis that includes the top 85% of medications by total spend. Jeff, talk about the process by which you make projections for the other spend management categories.
First, we use a lot of third-party data to look at how pricing on different services and devices has changed over time. We usually look at a 3 to 5 year window and how pricing has been changing up or down. We also look at Vizient pricing trends and how our pricing has been changing over time as well. We also look at a lot of raw materials and different things like freight and labor costs and how those may influence and impact pricing in the future. And finally, I have a conversation with over 50 different internal staff. We sit down and we go through all their product spend categories and all their devices and services. And we talk about what the suppliers are saying, what the contract terms are, when this may be bid, what they're hearing in the market, and what our strategy is for pricing on that category. And all those different things, past pricing, different types of raw materials that could impact pricing, and then what the market is saying, what we're hearing in the market, what our strategy is, all that is factored in to come up with the projections.
Okay, the moment we've all been waiting for. Carina, what is the projection for this edition?
For pharmacy, the overall estimated drug price inflation rate for the time period of July 1st, 2025 to June 30th, 2026 is 3.84%, which is slightly higher than our summer 2024 projection of 3.81%.
And Jeff, can you give us the projection for your sections?
For that same time frame mentioned, our overall projected price increase is 2.3%, which is very similar to the summer report in which we projected a 2.4%.
All good information. And where can our listeners go for more detailed information?
The full report can be found at vizientinc.com/pharmacy market outlook. Vizient provider customers can sign in to find additional resources and companion documents to the Spend Management Outlook.
Thanks, Carina. We'll be sure to include both of those links in the show notes. Thank you so much for joining us today to share your thoughts and insights. It's been really great chatting with you.
Thanks for having us.
Thank you very much for having me.
Please join us for more Verified RX podcasts. Subscribe today, like us, Send us your comments. We'd love to hear from you. Verified Rx is a prescription for success and is brought to you by the Vizient Center for Pharmacy Practice Excellence. I'm Carolyn Liptak. Thanks for listening.